Hello there, everyone. It is fantastic to join you today. Hello to everybody who is watching us live, and also if you are watching this playing back on our pages. My name is Sarah Hunstead. I'm a paediatric nurse, mum of two, and founder of CPR Kids. And I'm joined by Dr. Deb Levy today, who is a holistic paediatrician, and we are talking all about your baby boy's genitals today. So a subject that is incredibly important to know about. We're going to be going through penis and foreskin care. We're going to be going through common problems as well, and also some first aid in case any injuries happen. Before we go any further, and Deb introduces herself, I would love you to give us a wave or a thumbs up just to let us know all the technology is working as it should. And please, if you know any boy mamas out there, please tag them in the comments below, because knowing all about this is really important, because there are so many myths out there, aren't there, Deb? So much.
100%. Yeah. So anyway, great. Thanks, Sarah. And as always, so wonderful to be chatting with you. As Sarah already mentioned, my name is Dr. Deb, and I am a holistic pediatrician. I train conventionally, but now I integrate nutrition and lifestyle into children's health programs. Mm-hmm. And I'm very passionate about educating parents, because I do believe that the more knowledge parents have, the easier the journey is, because it can be pretty tough. I'm also a mum. I've got two young girls who are 4 and 5 years old, who are currently sleeping because I'm actually in Canada at the moment, even though I'm normally based in Sydney. So I'm very happy to be here and to be talking about all the boy bits that we can.
Exactly. And I mean, that is a disclaimer. Deb and I have girls.
Yeah, we're chatting about
girls. We're all over the girl bits. We know all about that. And we will be doing another one, which we'll talk about that too. However, clinically, we were actually discussing this before we went live. We have seen so much when it comes to the boy bits as well. So our expertise will be coming through in this talk. So let's start. Why don't we start with the newborns? So what are some common issues when it comes to the newborns? And then what we'll do is we'll work up into the older kids, talking about care and common problems. Okay. So newborn baby step. Let's start there.
Yeah, great. And just also to add, if anyone has any questions, we'd love to answer them, but we'll probably address that at the end. So start typing away in the comment section. We will come to you. Okay.
Yep. Absolutely.
Absolutely. Starting with your newborn, having a little boy, it can be a bit of a shock, because often. It's actually because often boys' genitals are actually quite swollen and enlarged. Mm-hmm. So dad might be feeling very proud when he sees his little boy being born. But it's just part of excessive fluid that's often sitting around the testes, and that's called a hydrocele. So that's entirely normal, and your baby's scrotum will slowly go down to a normal size, usually by about a year of age. It can happen much before that. But if it doesn't happen by a year, that's often at the point where we'll think of referring you on to see a surgeon, because sometimes the fluid that's sitting there isn't draining properly. I'm not going to go into the technicalities, but just to know that it's very, very common for little boys to be born with fluid sitting around their testes in the scrotum, and that's something called a hydrocele. Totally harmless, doesn't cause them any pain or any discomfort, and will slowly go away on their own. But it can be pretty impressive. So just so you don't get a fright when you see that.
Yeah. And if you're unsure, if you don't know, make sure you go and get it checked out, because that's an important thing. You want to be calm and know what's going on there.
Yeah, exactly. And you know how we would often diagnose that? It sounds a bit archaic, but we'll often get a torch. And that's it, and we shine it through, because then you can see it's just light, because there's nothing there other than fluid. But the formal diagnosis is made by ultrasound, but that'll often give us a clue. If, however, your baby has a hydrocele and you go home and it becomes very, very firm, or your baby seems uncomfortable, that it becomes tender, 100% that needs to be checked out urgently. Sorry, the other thing to mention, I guess, with little boys is the urethra is where the urine actually comes out of the penis. And sometimes babies can be born with the urethra not opening at the correct place. So instead of opening at the tip, it can open on the underside of the penis, and that's something called hypospadias. It's either obvious when your baby's examined, and all babies are examined in the first few days of life. But a clue can be if your baby doesn't have a good stream of urine. So just to flag that, but that is one of the things that your healthcare provider will look for when they're examining your baby.
And it can happen in other animals as well. So I've had a dog with hypospadias.
Oh, did you? I didn't know that. Okay.
Yes, it can. So there you go.
And that's something that will need to be surgically corrected. It is uncommon though. Unlike hypospadias, did I mention 10% of babies will have it? Whereas hydrocele, whereas hypospadias about 1 in 300. So it's really not that common.
Excellent.
The other things with penises is that even little babies can get erections. So don't get a fright if that happens. And
so
it's
normal.
It is so normal, exactly. The only time when it becomes abnormal is if it persists for hours and hours and hours, which again is incredibly unusual. So, I think those are probably the biggest things that I want to flag for the newborn babies in terms of things that can be a bit worrying, as a new parent, but that are entirely normal.
Yep. Do you want to talk about testes as well while we're here?
Thanks, Sarah. The other thing that's always assessed when your baby is born, again, a few days after, is whether or not their testes have descended. So I'll back up a little bit just to explain to you how testes develop, because then you understand the process. When babies are growing as a fetus inside you and they're developing, the testes actually start, as do ovaries, inside the abdomen. And as your baby grows and develops, the testes slowly move down into the scrotum. Mm-hmm. Sometimes that descent hasn't happened properly. So what can happen to little babies is that they're undescended, and that can mean they're actually still in the abdomen, which is more concerning, or they've actually migrated but haven't gone all the way down to the scrotum yet. So they might be able to be felt up in the groin area. The issue with undescended testes, and I'm talking here true undescended testes, and I'll go into that in a little bit more detail, is if they're still in the abdomen, they're exposed to abnormally high temperatures, which can cause damage. So that's always something that we need to exclude. If, however, we can feel the testes outside of the abdomen, i.e. in the groin or even high up in the scrotum, it's either something that we call like a retractable testes, because testes can actually go up and down, and that's just because they're on a muscle, and that's entirely normal. Sorry about that. Or they just haven't migrated properly down yet. So that's often something that we'll keep an eye on. If, however, the testes haven't descended properly by the time your baby is 6 months old, that is usually the time when they'll be referred to a surgeon. Okay. So this is not something that you have to worry about, other than being aware that it's being monitored by your healthcare provider. So in the the blue book or red book, whatever color book you have, one of the things that'll be ticked is whether or not the testes have been palpated. And if they haven't been, make sure that at that 6-week follow-up that they have been, because sometimes these things can, slip through.
So a question about that, Deb, is it usually both testes, or can it be one testes? What usually happens there?
I mean, what I've seen in clinical practice is that it's normally one, but I don't know the stats. Sorry about that, but certainly I've only ever detected one.
No, okay, excellent. So what I think is hilarious about our talks? How we use our hands all the time. We talk about things with our hands. It's just that whole, I do wonder what it must be for people watching us when we keep doing that. Okay, excellent. So we've covered the newborns and the common things that happens to them. So I think it would probably be a logical time, as we're going on talking about now getting into toddlerhood and so on, to talk about a little bit about care, and also, of course, for, the newborns as well, because, I remember when my husband, even though he is a nurse as well, looking after girl bits wasn't something that he had really done. And I remember him bringing our baby girl home and him looking and just going, come on, what do I do here? Come on, help me out. Like, what do I do? So for us females, it can often be the same, and also for men, because I mean, if they haven't been around babies, how will they remember? So one of the most important things is to realize that when it comes to the foreskin, that no matter what, it is incredibly important that you do not ever forcibly retract the foreskin. No matter what age your child is, never, ever, ever forcibly retract it. And so in the majority of newborns, it actually can't be retracted. Now, Deb, you were talking to me earlier. At what age would you expect your boy to be able to retract their foreskin?
So you're right, Sarah. It's 100% normal for babies' foreskins to, still be attached, so non-retractable when they're born. And the stats that I've read most recently have said that by about 10 years old, I always thought it was younger. So by about 10 years old, it's actually around about 50% will be retractable. Yeah. But like 99% by puberty. And when we worry is if it's not retracting during puberty and just after puberty. So I guess should we talk now a little bit about when it's not retracting, when it's too tight and not too tight? Do you want to talk about that now, Sarah? Or
yeah, why don't we hang on that for a second, because I reckon if we just finish off the care and then we'll get to the what to do if it doesn't retract or if there's issues there, because there can be issues. So I think what's important to realize is that not only is it normal for them not to be able to retract it, so that's important, that we don't forcibly retract it ever, that it is completely normal for boys to be playing with their genitals all the time. Okay, do not ever shame them for doing this. Do not tell them, no, it is completely normal for that. And often that's when they'll discover that they'll discover themselves that they are able to retract their foreskin, and often be them doing it, that may actually be discovered. And what is also normal is that when it is able to be retracted, that little white or yellow lumps may appear, which you might think is a little bit gross. It's called smegma. It is completely normal as well.
It can look a bit like pus. So that's why it's a good thing to be aware of it. Yeah,
exactly. So, and that is also completely normal. So when it comes to cleaning, as we've said, I'm going to say it one more time, just to make sure, don't ever forcibly retract it. Okay, you don't.
And the reason being, what Sarah is saying is that the problem is if you forcibly retract it, you can actually cause scarring. Which causes a condition that I'll talk about. So it's not just that it's going to cause them pain, which it will, but it can actually cause damage. So
exactly. So thank you. That's exactly why it's so important. So once it is retractable, okay, teach your child just to wash it like any other body part. So they may retract it when they do a wee as well. That's okay. But we need to teach them how to actually make sure that they put the foreskin back when they're done washing, or when they when they've done doing a wee, because it is there to protect. We don't want to keep it in that retracted position. So that's an important thing. And remember, kids are kids. They're going to play with it. It's normal. Normal. Lots of different things there. So what about issues? I'm going to talk about some first aid in a minute, but what about some other things, particularly around what you were talking about when you may forcibly
retract? Yeah. So what can sometimes happen, you may notice this in younger children who have a fairly tight or non-retractable foreskin, is that the urine will balloon. So you'll actually see when they go to the toilet to make a wee, it'll literally just balloon out, because the urine is just getting trapped between the foreskin and the tip of the penis, which we call the glans of the penis. So again, that doesn't normally cause any problems. It can sometimes cause a little bit of soiling and a little bit of like dripping of urine in their undies, because obviously it doesn't all get out when they make a wee. It does predispose them, however, to getting infections. So that is something to be aware of, and I'll talk about that in a second, called Balanitis. But it can, as well as urinary tract infections as well, if it causes enough blockage there. So that type of non-retractable foreskin usually resolves and there's never a problem. It's the true pathological phimosis, and stop me if I'm getting too techie here, where you have the scarring that I mentioned, that actually will not go away unless it's properly treated. And those type of problems, I guess they're more significant because they're not just going to resolve, and they can often also then go on to cause something called paraphimosis, which I'll go on to now. So as Sarah said, the phimosis is a non-retractable foreskin, and the clue to it is that you get ballooning of the foreskin with urination. It may not cause any problems, but it can cause infection or strictures and tightenings. And the next point to go on to is something called paraphimosis. And this is what happens when you've got a phimosis. So this is the one that with the scarring, that the little boy then manages to retract, and it gets stuck.
Yeah.
And let me tell you, it ain't fun for these kids. I've had to look after a mortified, preteen who is suffering from this. And what happens is that because the foreskin, this tight foreskin gets stuck usually just behind the gland, so the tip of the penis, everything then gets swollen, and it's impossible then to, reduce that foreskin back down. This, we try certain maneuvers in emergency, but sometimes though children will then have to go to surgery. They don't necessarily have to have a circumcision if it's not something that the family or the boy wants. But, it's not anything that's very pleasant, and it's nice to be able to avoid it. So again, it's about educating your boys not to retract their foreskin. And if they do retract it when they're cleaning, always to reduce it again. Put it back down. I think I'm using the right terminology.
And I think one of the important things to recognise as well is have good open conversations with your boys about this, so that if they did retract it and it does get stuck, that they can come to you straight away, that they can tell you this, that they're not ashamed or embarrassed or they think they've done the wrong thing and they leave it and it ends up getting more swollen and more pain, and leaving it is not a good thing. So make sure that you do have that relationship where you can actually talk about this, and as soon as something happens, that your older boy is able to come and go, I've got this problem, we need to sort it out. I think that's important. I have seen kids, like older kids who, 9, 10, 11 years old, who've been too ashamed to be able to tell their parent, and have left it for quite a while, which has caused more problems until it's excruciating and they can't go further. So please, please, please have those open conversations with your kids. Really important.
I guess the other thing just to mention, Sarah, I'm just noting the time, is I'd like to just touch on something called balanitis, as well as testicular problems. That'll probably just be 1 or 2 sentences. But balanitis is an infection of the head of the penis, so the foreskin and the glands area. And it's usually in uncircumcised boys, and it's tender, painful, and there's a discharge. So it's very obvious when your child has it. It's quite common for uncircumcised boys to get a little bit of inflammation just at the tip of their foreskin, that redness, but that's nothing to worry about. That's normal, and just some simple hygiene tips will usually resolve that. Maybe a little bit of cream, and even just almost like a diaper cream, I had to say it, but like a barrier cream. But the infection, you will know if your child has this infection. There's no doubt. As I said, it is very, very tender with that swelling, redness, and discharge. The treatment for this is either topical steroids, topical antifungals, or oral antibiotics. There's no place for topical antibiotics. But again, this is under the guidance of your healthcare provider, nothing that you have to self-diagnose or worry about, other than, as Sarah said, for your older kids, having that relationship where you can communicate openly. And for your little ones, just being aware of, when do I need to go to the doctor? What's going on here?
Yep, absolutely. Yeah. Fantastic. So I do have a question which has just gone straight out of my head. Where did it go? Okay,
well, do you want me to talk about testes while you're thinking of it?
You talk about testes while I remember my question.
Yeah, it's very quick. I guess all I really want to say about testes is if it's red or painful, get it seen quickly. I think that's kind of my message, because you don't know what it is. So the risk with testes is that you get something called testicular torsion, which means that within the scrotum, sorry, I'm using my hands again, the testicle turns on itself. So it's not like you see the whole scrotum turning, it's within the scrotum, the testicle itself twists. It's incredibly painful. It can be referred pain to the abdomen, so just be aware of that. You know, these kids can have a lot, like abdominal pain, might not be specific, but you know, it's something that is a medical emergency. So don't beat around the bush. Really, just go and take your child straight to an emergency department.
Yep, absolutely it is. Yep, I actually had a relative of mine who I got a phone call from, because you know what it's like when you have a nurse or a doctor, you get phone calls from all your friends and all your family. And I got this phone call. He's like, Sarah, the dog just jumped on my lap. His paws landed straight on my testicles and I'm in excruciating pain. There's something really wrong. Like, you need to go to the hospital straight away. And he actually had a something happened. So, but it was a very large dog, and something happened at sleep.
Maybe. Maybe the dog slipped and going. So,
and
obviously trauma as well, right? But then you know, and it's, you know, you're going to take your child in.
Yeah, absolutely. So, the moral to that story is, anything like that with testicles, please, you know, there's reasonably small window there. Just go and get medical help, emergency medical help.
And exactly, because the reason is that if you don't, you could lose that testicle, because the blood supply gets cut off very quickly, and then it dies off. So that's the reason.
Yep, exactly. I remembered my question.
Really?
So for you, you've got your newborn. You've got your newborn boy here. You've come home and you've gone, right, okay, I'm going to, I'm cleaning the nappy region. I'm going to wash. What is your gold standard, Deb, for taking care of your boy's genital area, just simply when you're doing nappy changes and baths? What do you want people to
tuck it down?
Mm-hmm.
Aim it down. Look, I mean, as you know, I'm a huge advocate of the least toxic, the better. So a very, very simple baby wipe with no fragrances, no nothing, even just a cloth with some plain water on it.
Yes.
Always wipe down for boys as well as girls, because boys can get urinary tract infections, and actually, they're more common in little boys than in little girls. So it's just simple, clean. Make sure you're cleaning underneath the scrotum as well, because often things get trapped under there. And then that's it. Diaper on, tuck it down so that they don't wee everywhere. And that would really be the simple advice that I would give.
Fantastic. So before we finish up today, just a little bit of first aid in there as well, because accidents do happen, okay? Whether it's when they're running around in nappy off time and something happens, it's just, sometimes accidents happen that you just, out of your wildest dreams, you can't even imagine how they happen. And sometimes kids are curious and they also put foreign bodies in their foreskins. So Deb and I were having a chat about this before we went live today. And I've seen quite a few things in my emergency department career. Probably the most memorable one was a little boy who came in who decided that he was going to try and stretch his foreskin over a little toy car. Not the best idea, to be completely honest. But so if that happens, if your child does actually put something in their foreskin or something into the eye of their penis as well, because I have seen that too. It's eye-watering. And so don't try and remove it, because it can cause more trauma coming out as well. So please don't do that. Carefully bring them to the emergency department. Don't give them anything to eat or drink, just in case they do need an anaesthetic to have whatever needs to be done. And importantly, just keep them calm. come up and see the triage nurse. She'll triage you, and then you'll be seen by a doctor in ED. So that's an important thing when it comes to the foreign bodies. If there is a trauma, such as falling off a bike or running into something, I've also seen a dog bite running around naked as well. I know, Deb, I've seen a lot of stuff. And so what's really important, if there is a cut or laceration to your child's penis, first thing you need to do, as with any first aid with bleeding, is stop the bleeding. So you're going to use something clean and dry, such as a tea towel or a piece of gauze out of your first aid kit, and you're going to put firm direct pressure over the cut for a minimum of 5 minutes or until the bleeding stops. And then, of course, being a genital area, it's important that you do get that medically seen. If it is significant, so it continues to bleed after the pressure, or it's quite a large cut, then please call an ambulance. But otherwise, seeking medical help is also very important. So is there anything else you want to add, Deb? Or do you think...
I wanted to ask you, have you ever seen a hair tourniquet on a penis?
Yes, I have. I didn't think of talking about that today.
Yeah.
So a hair tourniquet. So hair tourniquets, you know, I want to say they're common, but I wonder if it's that skewed because I've seen a lot of them.
That's why I asked. I've seen them on fingers and toes, but never on a penis. That's why I asked you if you'd seen it on a penis there.
I've seen 2 on a penis, but I've seen a lot more on fingers and toes.
Yeah.
So a hair tourniquet is when usually one of mum's hairs, because, you know, it's all falling out, you know, after you have
Remember those days, yeah?
Yes, I do, falling out in chunks. And what it does, sometimes it gets into the socks or the little onesies, or just, you know, from them being around you. And it actually can wrap around one of their digits or the penis. And what it does is sometimes you won't notice that it's there until the tip of whatever it is may start to become red, swollen, and so on, because what it's doing is it's essentially cutting off the circulation. And so it's really important. That is actually a medical emergency, and you do need to be able to take your child to the emergency department to have that taken off. I certainly know that a lot of that people may try and take off the hair tourniquet at home. That can be really tricky, particularly if it has been around there a while, because it can actually go in quite deep. The hair can break as you take it off as well. So that's why in my opinion, I actually think it's a better idea to go to the emergency department, especially if it's a penis. Don't go mucking around with that. I know there is a lot of stuff on social media about hair tourniquets that talks about putting Nair, which dissolves the hair. Certainly that is something that I have seen done in the emergency department. I do not recommend that you do that on your child's penis because that, you know, could be quite painful. And we do have, you know, those crazy goggles, all the lights and all the rest of it, that we can really check to make sure that the hair is off.
And good pain relief, because it's painful. Yeah, and maybe even some sedation for your child, or so that it's not as traumatic for them.
Yeah, exactly. So anything you want to add to that with the hair tourniquets, Deb?
No. I just wondered if you were going to chat about it.
Yeah, no, I've seen that too. So we've covered a lot today. We've talked about
anything.
Yeah, let's just have a look in the comments. I don't think we have any questions, anyone? Or have we talked about it so extensively that all your questions have been answered? Hopefully that is the case. So next week, we are going to be talking about little girls' genitals, okay? So we'll be going into the same stuff that we have this week, as in common problems, first aid, and general care as well. So make sure that you tune in same time, same place next week as well, and we will be talking all about that for all of you girl mums out there, and parents and family members, because I'm sure it's not just mums watching us at the moment. So thank you for joining us today, everyone.
Thanks everyone. And in the meantime, catch us both on Instagram. There are handles below, and I think we're going to jump on with a few more fun things about genitals, if we don't have the Facebook and Instagram police chasing us down for using inappropriate words. But we'll have to try and work our way around that.
Yeah, see, that's what drives me nuts. This needs to be talked about.
100%.
Yeah, exactly.
And I'm not one that likes to use non-anatomical words. I'm very pro using, the real words for vagina and penis, and
Me too.
So apologies if we don't always, but there's reasoning behind it as well.
Exactly. It's an important thing. All
Yeah.
right. Thank you,
Thanks,
Deb.
Sarah.
Thanks,
Thanks, Sarah.
everyone. We'll see you
Bye.
soon. Bye.